With so many of us running around for the holidays, it's important to get some quality sleep.
But almost impossible. But if you can't due to sleep apnea, our next guest might have something to help. So please welcome back Brett Bigelow from Sound Sleep Medical. Good morning, Brett. How you doing?
Good morning.
Good morning. How are you guys doing? So nice to see you.
Good.
Nice to see
Great
you too.
to see you.
So for those who aren't necessarily aware, untreated sleep apnea, what are the signs and symptoms?
You'll wake up in the morning, you'll feel like you haven't rested. You'll wake up with a headache, you'll wake up with a sore throat, but you'll have that brain fog and that fatigue that sets in. That's like the everyday reminder. The other one is typically your partner, the spouse, saying, hey, we got to do something. Something's wrong. Or you're going to be in another room. That's typically what we get.
Yeah.
And how does sound sleep help with someone who's struggling to get that proper sleep?
So two ways. If you had a viewer that just called because they identified that they had a problem, they would get the same treatment as if they went to their doctor and their doctor wrote a referral. So that would be they would come in, they would get a home sleep test, that's free of charge. They would get an analysis of that, which is an interpretation of the results, that's free of charge. And then we will put them on a path towards some kind of a treatment plan. Typically what we do with people that have obstructive sleep apnea is we go with the oral appliance.
Yeah.
The oral appliance is the way to go.
And obviously there are other ways and other routes people would typically go down, and you guys are very different to a traditional sleep apnea method.
Correct. There are some people that unfortunately they're going to need a CPAP or a BiPAP, but for the people who have an AHI, which is basically your apnea score of 25 or under, we want to get them in, we want to give them a treatment option, and we want to take all of those people that don't want to use their CPAP, and we want to give them a treatment option as well. Right. So if you're currently on a CPAP, don't be afraid to call. We can give you another test, and we can figure out a path for you too.
And how does the treatment differ from that traditional method?
Well, obviously the Avant, which is the oral appliance that's in front of us, there's no tubing. You're not tethered to your bed. You don't have to wear a mask. There's nothing to change. And it's a simple cleaning process. In the morning you wake up, you put it in its little cleaning case with some Effordent, just like someone who has dentures, and it cleans itself.
Yeah, and you've been on before, and this is something that I think a lot of people aren't familiar with or aware of. It's not just about the bad night's sleep or the disgruntled partner who's sleeping as well. There are more significant things that can come because of this.
There's the long-term health benefits, because if you have obstructive sleep apnea and your body isn't taking in oxygen when you're sleeping, your body isn't resting, so your brain isn't resting. It's not getting oxygen. Your heart rate is elevated. There's times you look at sleep results from someone's home sleep test, you say, wow, you went 3 minutes without breathing.
Crazy.
That's significant. So early onset Parkinson's, early onset Alzheimer's, and then all the damage that it does to your organs.
Right.
Yeah. You've already described what sort of the patient journey really looks like, but what's some of maybe that feedback that you've received from patients having gone through your program?
Right. So how we're a little bit different is this. They're going to kind of identify a patient that they have a problem. So they kind of know something's wrong. So we fill them in with the results of the sleep test, and then they get an oral scan, which is what makes us different. It's not a mold. You don't have to bite down on anything. You lay down just like you're in a dentist office. One of our hygienists will do an actual 3D oral scan of your mouth. And the great thing about the oral appliance is it's a perfect fit just for you. Right on your teeth, clips on, lets you know it's time to go to sleep. You can still drink water, you can still speak, but it's just a unique way of treating sleep apnea.
It's the time of year when people give out gifts and are very generous.
Yes.
And you're coming
Do
into
you have gifts?
No, hang on, Jess. We're talking about
gifts.
We're talking about gifts for the viewers. You guys have a special offer right now.
So regardless of your situation, whether you come from a doctor's office as a referral or you call because you saw the show or you just walk in, the first 50 people that we get, it's going to be absolutely free. There's going to be no commitment to anything. We're going to update you, let you know exactly what your diagnosis and your problem is, and put you on a treatment path free, no problem, no
That's
issues.
so great.
Yeah, that's
well,
great.
Brett, always a pleasure when you come in
Always
studio.
a pleasure. Happy holidays.
Yes, thanks for joining us. Happy holidays. Take advantage of that special offer. It's right there on your screen. Sound Sleep Medical has offices in Henderson and West Las Vegas.